And welcome to Nursing 11. This is Law and Ethics for Nurses. I'm your instructor. My name is Donna Irvin, and I will be guiding you through this course. This is a course which addresses ethical issues in the practice of nursing, and you're going to find you're going to have some ethical issues as a student, maybe as well as during your practice as a professional nurse after you've begun your work experience. So this course actually is going to begin on October the 6th with you doing reading at home. And what I'd like you to do is to go into the ANA website, look under ethical issues, ethics, and then ethical issues. And you're going to be looking at a lot of the bulleted areas there, including rights, speaking up for your patients in the era of healthcare. So everything that's in that section is going to be pertinent for you to kind of go through and make sure that you're clear on some of the areas which might affect you. So that will be reading that you will be doing on October the 6th. You're going to go to the ANA website, go into ethics, ethical issues, and just go down that first left-hand column looking at all of those items that are presented to you. This is a hybrid course. What that means for you is that you will be doing quite a bit of your instruction online through reading Potter and Perry, also through different links that will be given to you for different articles to read, and then also I will be giving you information in class which hopefully will aid your learning process. You will have an opportunity to ask questions. You'll have an opportunity to dialogue with others. We'll try to get the blog set up. I'll be honest with you, this is my first time working with Moodle, but I'll try to make sure that the items you need are accessible to you. I'm still learning Moodle. What we want you to do is also go to the Board of Registered Nurses, and there's some website information there for you to learn. What's going to be important for you to get from this class is how all of this ties into your practice. There will be different types of ethical conflicts that will come up. There will be issues that we'll discuss about the Good Samaritan law, pain management for your patients, the importance of wearing your name tag, how you can be an advocate for your patient. You will look at the 9 provisions of the Code of Ethics. And what I want you to do is to start thinking about if you were faced with an ethical conflict, which will be presented to you along the way, how would you handle that? We're going to look at ethics as well as bioethics, and I want you to be familiar with both of those terms. When we look at ethics, we look at it as a part of our profession, and why do we need to even focus on this is because our profession is one that's held in very high esteem up there with doctors and attorneys. It's at that same level. People look up to educators, nurses, doctors. They look at us as having a wealth of information, and especially healthcare information, and they trust that we're going to give them the correct information and provide them with the best care. Sometimes issues may pose themselves to us which provide a conflict which we have to iron out with our healthcare team or with your superior that you're working with. So what we want to do is give you some tools that will help you make some good decisions as these issues come up. We look back at the history of the development of the American Nurses Association, and in 1896 they began to look at different provisions and ways that nursing could actually show themselves to be a profession that should be given a high level of respect. And one thing they thought about was that we needed to have a code of ethics to drive our profession, to be the foundation for our profession, and that's why it's very important. This framework was also used internationally in other countries. We actually have presented a gold standard of behaviors that other countries use to this day. So it's very important that we do that. If you go into nursesbook.org, you'll actually see that there are some paragraphs which actually outline that this is actually central and necessary as part of a professional basis from which we should work, which is very important. What I'd like for you to be able to do is to share this information with us in class and be prepared to answer some key questions as they're posed to you. understand that we will have some in-class sessions. Most importantly, you're going to have a midterm, which will be in class at the campus. You will also have a final comprehensive examination in class on the campus. The midterm is going to be 40% of your grade. The comprehensive final examination will be 60% of your grade. So you will be presented with a syllabus, and I want you to make sure that you have been able to pass with, I think it's 75%, so that you can move on and go to your clinical site. They will not allow you to move forward and go into the clinical areas unless you have passed this course. So read your syllabus very carefully. If you have questions or concerns, I'd like you to be able to contact me. My number is going to be on the syllabus. You can text me. You can also phone me. You can actually meet me on campus Mondays after 5 o'clock. I will be on campus in the nursing office, and we will choose a room to go to where we can actually sit and we can dialogue about some of the concerns that you have. So if you want to meet with me, please let me know in advance that you'd like to do that. I don't usually try to set up meetings that exact same Monday. So if you know you have a question, try to get to me about Thursday or Friday the week before so I can make arrangements to be there on Monday evening, because that is normally not a time when I'm there. I will be there specifically for you if you have direct questions that you'd like to ask. So I'd like you to have fun with this class. I'd like you to learn a lot about the law and how it pertains to nursing. And I'd like you to use this time to actually understand how this governs your practice and your behavior in the setting when you're out there doing your best work. So thank you, and I look forward to seeing you in class on the 13th.